Affordable Care Act subsidies that lower monthly insurance premiums for millions of Americans have expired.
ACA subsidies or premium tax credits help lower or eliminate the out-of-pocket cost of monthly premiums for those who purchase coverage through the ACA marketplace.
Now, Congress had until December 31st, 2025 to strike a deal to end the tax credits. The Biden administration first enacted the credits during the COVID-19 pandemic, further extending them through the Inflation Reduction Act.
ACA subsidies became a sticking point during the longest government shutdown in U.S. history in October and November of 2025. Republicans said the expansions from the pandemic era went too far and supported funding a temporary spending bill that didn't include the expiring ACA subsidies.
Meanwhile, Democrats insisted on extending the premium tax credits as part of a bill to end the shutdown. House Minority Whip Catherine Clark wrote in a post on X Wednesday, quote, "Millions will see their premiums skyrocket because Republicans refuse to act. You deserve better, and Democrats will keep fighting to lower costs."
An analysis by healthcare research nonprofit KFF found that on average, more than 20 million subsidized enrollees are in the Affordable Care Act program would see their premium costs rise by 114% in 2026. Well, another congressional failure. We've talked before about how ineffective Congress has been. In fact, there was a research study done at the end of the year that found this was the least effective Congress in terms of passing legislation in American history. They seem to break that record every single year.
They broke that record
right?
last year for
They
sure.
did, yeah, and then they broke it again this year. And I don't think either of the plans that were offered were in any way compromises or particularly useful to the American people. I mean, the Democratic plan was to extend the ACA subsidies for 3 years, which the subsidies were introduced in the American Rescue Plan, as we mentioned, which was voted for entirely along party lines. So Democrats were the ones that proposed these subsidies expiring at the end of 2025 in the first place. And then all of a sudden, when they could blame it on Republicans, they wanted Republicans to take the heat for the subsidies expiring. And then on the Republican side, their solution was to offer people, I think it was like $1,200 in a health savings account, which is not even close to comparable to the amount of that people were getting to cover their health care in subsidies. And also HSAs are a different mechanism when it comes to paying for premiums, right? These are things that can be used. It's tax-free money that you can spend on health services, but if you still have a $3,000 a month premium, that's not really helping you out that much. And so I think both plans were real stinkers, and nobody has really offered a comprehensive solution to what has clearly become the Unaffordable Care Act.
Yeah, and I think ultimately broader reform is needed, and that requires Democrats and Republicans to figure out what the health plan is. I mean, ever since Obamacare was proposed, it's been like a no from Republicans, but understanding that the healthcare system needs to be reformed and that people weren't going to get health care. That was the other option. And just to really go into who this diverse group of people that are represented by the Affordable Care Act is people that make a little bit too much money to get Medicare or to get covered in those ways. And so there's like this in between that don't get insurance to qualify for Medicare or Medicaid. And some of them are self-employed workers. Some of them are small business owners. Some of them have to get their small business staff health insurance and want to keep them employed. And I think that it's at their own peril. I mean, kicking the can down the road is just a Band-Aid on a bigger problem. So what Democrats want to do, obviously, is not the ultimate solution, but it's at Republicans' peril if they don't address this at all. And I know they've talked about possibly addressing it this month, but those people in that in-between that aren't poor enough to be on government insurance and aren't well off enough to, or don't work for a company that supports insurance in some decent fashion and covers a lot of those costs, well, they're just kind of in between, and they're going to go back to having no insurance at all, which ends up with people in, let's say, emergency visits or unplanned hospital visits. Who's paying for all this stuff? And so I think that there really has to be a conversation about how these constituents will be affected when some people went from $85 a month, a social worker I read on Axios, to $750. She's like, I'm just going to get insurance for my 4-year-old and not have any for myself.
Yeah, I mean, I was on the ACA a few years back when I was working for a British company, and my premium was $1,200 a month because I made more than the subsidies would allow. And oh my gosh, it was insane. Like, as a young, healthy person paying $1,200 a month, it's just outrageous.
Yeah, it's pretty impossible. President Trump seemingly giving up the fight to deploy National Guard troops to Democrat-led cities. Let's stick around for that.